Hi, I'm Rachel Yaden, and I'm going to be talking about prescription drug misuse, abuse, and addiction, and the specific health concerns that come with it. Let's see if I can get this program to work. There we go. Okay, so population. Drug abuse and misuse does not discriminate. It doesn't discriminate with neighborhoods, income levels, gender, age, and religion. So kind of talk about that. You see prescription drug abuse in suburban, rural, and urban areas, high income, median income, low income, poverty. Males have a higher incidence than females. And then teens and young adults do make up a large portion of the population addicted to prescription drugs or misusing them. And then an even higher incidence in the adolescents who are gay, bisexual, and transgender. Um, so obviously there's going to be risk factors when talking about who's at a higher risk for being addicted or misusing prescription drugs, but it also just blanketly does not discriminate. A thing I read while researching this a lot was about Utah specifically was that more than 50% of Utah's population does belong to the LDS Church. Um, and so yes, a portion of Utah's LDS population is addicted to prescription drugs. So again, does not discriminate with religions. So when we're talking about the size of populations, Weaver County and Salt Lake County were in the top 7 counties in Utah that have the highest prescription drug abuse and misuse rate, and it accounts for 20.38 per 100 people for deaths from prescription misuse and abuse. Statewide, Utah sits at the top in the top 10 states in the U.S. for the highest number of drug overdoses and abuse. So more deaths are caused from overdose in Utah than car accidents, which is saying a lot because car accidents happen quite frequently. So that's also meaning that overdoses are happening more frequently than car accidents. Nationally, prescription drug abuse is considered a national epidemic in the United States, and the United States account for about 75% of the world's use of prescription medication. Internationally, there wasn't quite numbers internationally. We do know that prescription drugs are abused all over the world, but this fact about opium I thought was interesting. So from 2016 to 2017, global opium production jumped by 65% to 10,500 tons. The highest estimate recorded by the UN ODC since it started monitoring global opium production at the start of the 21st century. That was from the 2008 World Drug Report. So as you can see, it is affecting it can affect everyone, and it does affect people all across the country, all over the world. So the social determinants of health, kind of some contributing factors are family history of prescription drug abuse, homelessness, low income and high income. And I thought it was interesting, but the high income, they have the money to more easily get prescription medication or get it more prescribed by doctors. Poor health, incarceration, limited access to healthcare, poverty, minority groups, lower levels of education, and then obviously health issues, both physical and psychological. So lots of people obviously start out abusing probably their own prescription from a physical standpoint of chronic pain or a surgery, and then psychological as well from kind of mental health issues. Because when we're talking about prescription drug abuse, we're not just talking about narcotics. We're talking about stimulants and we're talking about depressants. And so it's not just narcotics. So studies have shown that families that talk about the dangers of prescription drug abuse have a lower percentage of their children will experiment or misuse prescription medication. A recent study showed that victims of bullying, and specifically cyberbullying, has recently played a large part in teens and young adults misusing and abusing prescription drugs. So some specific concerns, obviously overdosing. That is one of the, that is the biggest concern when talking about abusing prescription drugs. Also poisoning, so you may not overdose, but you're hitting a level which is become poison to the person taking it. And then this is huge. 80% of heroin users started by abusing prescription drugs. So prescription drug abuse and misuse and addiction is a gateway drug to harder um, illegal drugs such as heroin. So that is a really big percentage of heroin users started out this way. Root causes. So in 1999, farm companies came out and said that opiates were not addictive. And we obviously know that that is not true. And so that's when people started prescribing them left and right because they're like, oh, well, they can't get addicted to it. But that is not true. So that is like one of the biggest places that kind of went wrong there. Doctors are overprescribing. Patients are, quote, losing prescriptions. So they're calling to ask for another prescription when they still have theirs. And then there are patients who seek multiple prescriptions from different doctors. So they'll be visiting numerous doctors' offices to kind of get their fix, if you will. Maslow's hierarchy of needs. So there's two different ways that this kind of goes. There are the reason their needs are not being met, so they start taking prescription drugs, misusing them, and their needs are not being met because they're taking them. So there's two different kind of sides here that we're looking at. So I mean, when taking prescription drugs, you can, there like you may not be able to function well enough to provide food and shelter for yourself or your family. Safety wise, you're at a higher risk for being unsafe to yourself, to others, securing employment, health resources, and properties. And then you may start misusing prescription drugs because you're looking for friendship, intimacy, family, or you may have a lower self-esteem, or I mean, there's just lots of kind of ways you can come at this with Maslow's hierarchy of needs. So, kind of want to touch on that real quick. So, communicable diseases or infections. This is something that was a little bit harder to find because you see a lot more communicable diseases and infections with kind of the harder drugs, but also just taking, say you're addicted to Xanax, it's probably not going to lead to HIV, but taking prescription medication does put you at a higher risk for risky behavior. So, and by taking them, I meant like being addicted to them. So, hepatitis, HIV, endocarditis, and STIs. Non-communicable diseases, there are so many side effects to these drugs and side effects about overdosing. With opioids, the most we see is feeling high, the slowed breathing, confusion. Anti-anxieties are drowsiness, confusion, slurred speech, poor concentration. And then stimulants, irregular heartbeats, decreased appetite, high blood pressure, high body temperature, anxiety, and paranoia are just a couple of them. So self-harm and self-care, biggest ones are overdosing, poor decision-making, withdrawal, hallucinations, aggressiveness, paranoia, and then illegal drug use if it kind of progresses to that point. Risk for harm by and to others. DUIs are huge. We think of when you think DUIs, you think, okay, driving under the influence. And when I think of DUIs, I think of drunk driving. But that is not the only way you can obtain a DUI. It can be from driving under the influence of illegal drugs, prescription medication, etc. So that is a huge thing because then you have, the use of prescription medication and driving. Hostility towards other, and then increased risky behavior, which can not only affect yourself but others around you. And that is kind of basically the kind of overview and nitty gritty of prescription drug misuse, abuse, and addiction. So, thank you so much.